Come in.
Hey, Mr. Forbes. My name is Jody. I'll be your nurse practitioner student today. I'm just going to wash my hands and grab some gloves. So what brings you to the clinic today?
I need a physical for a new job I'm starting.
Okay, so what we'll do is go through, checking how you're moving around and how you're feeling, and then we'll just kind of talk a little bit as we go through the examination. But first, I just want to get some general information from you. Are you on any medications right now for any reason?
No, ma'am.
Okay, do you take no prescription medicines? What about over-the-counter medicines? Like Advil, aspirin, or any other?
Occasionally pull like everybody else.
Okay. What about any kind of herbals or vitamins?
It comes and goes. Sometimes I do, sometimes I don't.
Are you taking any right now?
Not on a regular basis.
Okay. Are you allergic to anything?
No.
Okay. So let's talk about your medical history. Do you have any medical problems at all right now?
Nearsighted, whatever you call it.
Okay. Oh, you have reading glasses. Do you have you had any surgeries in the past?
No, ma'am.
Okay. Any injuries?
Nothing serious, no.
Okay. So have you ever been in the hospital because you were sick or had
No,
to
ma'am.
have anything done? Okay. Are you up to date on all your immunizations?
Yes.
Okay. Do you get yearly exams? Do you get your prostate exams and things like that yet, or?
Yes, ma'am.
Okay. When's the last time you had that done?
Within the last 6 months, probably.
Okay. Do you have any family history that I should be aware of, like your grandparents, siblings, anything like that?
No, I only know one side. I was adopted from my mother's side. Nothing out of the ordinary.
Okay, so your grandparents are alive or deceased?
Deceased.
And what ages were they when they passed away, and what did they pass away from?
I don't know exactly. Grandmother 60, grandfather 65.
Okay. They died of
Grandmother, I'm pretty sure it was a stroke. Grandfather, heart attack, I think.
Okay. Are your parents still living?
Yes, ma'am.
Okay. And your mother and father, are they in good health?
Yeah, decent. They're in their 70s, later 70s too, so they're doing pretty good with that.
So your mother is your biological parent, and your father is
Yes.
your stepfather, correct? Okay. Now, do you have any siblings?
Yes.
Are they in good health?
Mhm.
Are they around your age?
A little bit over.
Okay. Okay. Do you have any children?
Yes.
Okay. Are they in decent shape, or are they?
Yeah, they can.
Do you have any kind of behaviors or habits, like drinking, smoking, using any kind of illicit drugs?
No, ma'am.
Okay. Tell me about your eating and exercise habits.
Could be better, I guess, but I do try to work out and eat decent.
Well, tell me what you do for your work.
I'm an artist. I don't just paint. I do some outdoor mural stuff and computer stuff and paintings.
Okay. So are you around any kind of toxic chemicals, paint fumes, paint thinners, anything like that?
Occasionally, but
Okay.
not a lot. And if I do, I wear a mask. Or a
So
respirator.
you're aware of the safety precautions that you need to take with them. Okay. Well, good deal. I'm going to walk out, let you get changed, and then I'll come in and we'll start doing your exam, check you out, and make sure everything's looking good. Okay.
All right.
Okay.
Come in.
You changed and ready?
Yes.
Okay, Mr. Forbes, we're going to start out just looking at your head, eyes, ears, nose, throat, neck, and I'll just kind of talk to you as I'm examining, okay?
All right.
So I've washed my hands, got my gloves on. Have you had any issues with your scalp or your hair or anything? Okay, no lesions, no tender spots. I'm just feeling around for your pre-auricle and post-auricle, all the lymph nodes. Have you had any sinus issues? Does that hurt?
I don't have any.
No kind of problems with your sinuses? Okay, let me look at your eyes. Your eyes look good. I'm just going to look at your conjunctiva. They look symmetrical. Everything looks good there. Does your ear hurt or have any kind of sensitivity? Have you had any ear problems? Okay. All right. I'm going to check the patency of your nostrils, so just breathe in. Okay, breathe in. Do you have any kind of allergic rhinitis or seasonal allergies or anything like that?
Not really.
Okay.
Sometimes.
Clench your jaw for me. Okay, puff out your cheeks for me. Smile real big. Okay, that's fine. Having trouble swallowing?
No.
Okay, I'm gonna bring this down just a little bit. I'm just gonna feel around on your neck. I'm gonna look at your veins in your neck just to see if I see any pulsations or abnormal jugular vein distension, and I do not. Okay, this is an otoscope, and I'm just going to use it to look inside your ear. I'm just going to pull this back a little bit and then just kind of look inside here. I don't see any abnormalities. Okay, can you lean back for me? I'm going to just look in your nose. I'm just going to dim the light so I can check for your pupillary responses. That looks good. Open up your mouth for me. I'm just going to look in the back of your throat. I'm going to use this tongue blade. Say ah. Okay. Tonsils that are at an expected location. They don't appear to be swollen. Did you ever have any tonsil problems when you were a child?
No, ma'am.
Okay. All right. If you could just look at my finger and follow my finger where it goes. All right, just stare at my finger. Okay, so your eyes are adjusting to accommodation. I don't see any extraocular eye movements that would be concerning. So I'm just going to check for the light reflex, your optic disc. And I see if there's no abnormal light reflex. I'm going to check for tactile fremitus. If you could sit up and kind of face the window over there a little bit. Just say 99.
99, 99, 99, 99, 99, 99.
Okay. I'm just going to percuss over some lung fields. Okay. I'm going to check for diaphragmatic excursion. Just breathe in deep for me. Okay. The diaphragm extends as expected. I'm just going to take a listen to you. Just breathe in and out for me. Breathe in. And out. Okay. Breathe in. Breathe in. Breathe in. Okay. Just say 99 for me.
99, 99, 99, 99, 99, 99.
Okay. Have you ever had any problems with your lungs?
No.
Had any kind of pneumonia or any kind of issues? Any family history of lung problems?
Nope.
Okay, you can turn around. Okay. I'm just feeling for any kind of abnormal pulsations. You say no?
99, 99, 99, 99.
Okay. I'm just going to listen to your heart. hear any murmurs, gallops. I don't hear any abnormal heart sounds. And I don't hear any lifts or thrills. Just gonna take a listen real quick over your aorta. Okay, if you can lay back for me just a little bit, I'm gonna go ahead and check out your abdomen. Have you had any stomach problems? All right, I'm gonna listen to your stomach. I'm gonna listen to vowel sounds in all 4 quadrants. Do you have any indigestion?
Occasionally.
Okay. Any tenderness, pain anywhere? Okay. All right. All right. You can sit up for me. Okay. I'm going to check your pulses in your hands. Check your radial pulse.
Okay.
That's good. Have you ever had any problems with any kind of circulation?
I think so.
I'm going to check your pedal pulses and posterior tibial pulses. Pulses are +2, so that's a normal finding. The skin appears to be a normal color. I don't see any cyanosis or jaundice. Capillary refill is less than 3 seconds. I don't see any clubbing or anything on the fingers to indicate this disease process, so that's good. On the skin, I see a few little areas, but I don't see anything of concern. I don't see anything that's irregular or multicolored. I don't see anything larger than 6 millimeters in size. All right, I'm gonna test some reflexes on you. Yeah. Did you feel it? Yeah. Okay. All right, we're going to test some fine motor skills. If you can just put your hands on your legs and turn your hands back and up and down like this. Supination and pronation. That looks good. All right, if you can take one heel and put down the shin of your other leg.
While I'm sitting?
Yes.
Like that?
Do the other one for me. Great. All right, if you can touch your finger to your, hold your hands out beside you and touch your finger to your nose. Okay, good. All right, you can put your arms down. Okay, we're going to check some range of motion now. So if you can just hold your hands out and pull your wrists up like this.
Straight out like that?
And down. Great, okay. Okay, if you can stand up for me. All right, just hold your arms out beside you. Lift them all the way up. Okay, all the way down. Okay. If you can bring your arm across your body like this and back, like this, back. Any problems with your shoulders? Ever any issues, pain, tenderness, inflammation, anything? Okay. Hold your arms up like this and down. Hold them up again and don't let me pull them down. Then try to push down on mine. Okay, good. Okay, if you can lay back in the chair. Okay, if you can bring this leg over that foot while it's straight, just put your, okay, put it back in the other one. All right, now bring your leg out from your body as far as you can this way and in. Now if you could bring your knee up toward your abdomen, just flex your hip joint. Good. Perfect. Great. Okay. Now flex your foot down to the ground and up. Okay, now turn it in and out. Okay, good. Any pain with your ankles? You can have a seat back up. Any pain with your ankles, knees, shoulders, elbows, wrists?
No.
Okay. Well, you seem to have pretty good range of motion, full range of motion from what I can tell. I'm going to have you stand up and lean over just so I can check the alignment of your spine. Okay, just face away from me. Everything looks symmetrical, so if you can put your arms out in front of you and just bend straight over from the hips and don't bend your knees.
How far?
Keep going.
That's as far as I.
Okay, that's good. You can stand back up. Gluteal folds are symmetrical, shoulders are symmetrical, even height. If you can lean back for me as far as you can go from your hips. Good. Okay, you can have a seat. Okay, well I think that concludes our exam. I'll step out and let you get clothes back on, and I'll come back in and we'll talk about a few things, okay?
Okay. Come in.
Hey, Mr. Forbes. Okay, so I didn't see anything to raise any concerns. I'm glad you came in today. I'll sign your forms for you to have for your job, and everything looks good. If you do have any further vision problems, I would suggest you go see an ophthalmologist so that you can get your prescription eyewear handled so that you can have your vision corrected appropriately. And then if you have any other problems, you can always come back in and see us. Do you have any questions for me right now?
No, man.
Okay, well thank you so much. I appreciate it.
Thank you.
Have a good day.